Alex, what's the difference between getting an ozone treatment in a clinic versus doing ozone therapy at home?
Okay, so the biggest distinction here would be in a clinic or in a doctor's office, you are going to be getting most likely an invasive treatment, which involves puncturing the skin. So this would be something like major autohemotherapy or what is called IV ozone, where the blood is taken out of the body, infused with ozone, and then put back in the body. Okay, that's just one example. And then home ozone treatments can be considered non-invasive, where they do not puncture the skin. So basically, you're using ozone gas or ozone oil or ozone water, but you're using ozone in, on, or around the body to heal. And just to clarify one more thing, this also means like insufflations or doing an ozone sauna or breathing ozonated oil or ozonides or drinking ozone water. And one more distinction would be you can also get non-invasive treatments done in a clinic, but not the other way around. Like you're not going to be doing IV ozone, so puncturing the skin at home. So in a clinic is invasive usually, and then at home are non-invasive treatments.
Okay. And so in the non-invasive realm, there's a lot of different forms and applications and way of introducing it in and around the body.
Yes, there are so many. So you can do ear insufflations, nasal insufflations, vaginal insufflations, rectal insufflations. You can get it in ozone sauna where basically the heat opens your pores and then you're absorbing the ozone gas. You can do breathing ozonated oil. So that's where ozone is bubbled through the oil first, which creates ozonides, which are then safe to breathe in. That's great for respiratory issues, anything to do with the lungs. You can also do ozone cupping. You can do ozone limb bagging, where basically you put a bag around your arm or your leg, and then ozone gas is infused into the bag. And that's a great topical treatment for, say, eczema or rashes or poison ivy or bug bites or anything like that. And there are more treatments that you can do at home, but for the sake of time, I'll stop there.
Yeah. If someone gets interested, they can listen to the next episode, which is the full conversation that you and I had. But let's say someone's hearing this like, okay, wow, I didn't even know that this was possible to do at home. I thought I'm only familiar with it in the clinic setting, maybe more invasive. It seems high tech and there's medical considerations. So if someone's now opening their mind to the idea of this is possible at home, a lot of times people's first thought is this is dangerous or I'm gonna hurt myself. Again, we cover this in depth in the upcoming episode, but at a little higher level, how do you first answer that for people?
Yeah, and it's just like anything with any therapy or any treatment. Of course, there are going to be considerations to take into account before you decide to do it. And in being a safe and confident home ozone user, there are things that you need to be aware of. Like I have to have an oxygen tank in my home, which now I feel completely comfortable having an oxygen tank in my home. My husband and I did van life where we traveled throughout the United States and Canada, and we brought our oxygen tank with us. It's the same thing, say, if there was a propane tank in an RV. And there are considerations you need to take, just ways that you can stay safe with having an oxygen tank. Same thing, you don't want to breathe high concentrations or high volumes of ozone gas, which can be irritating to the lungs. So there are different considerations that you take into effect and that you learn before practicing ozone therapy. And it's nothing crazy. It's nothing dangerous. Yes, it can be intimidating at first, but if you think about anything that you've learned in your life, whether that's soccer as a kid or doing coffee enemas or running a business, like there are going to be growing pains, and there are going to be things that you need to learn. And ozone therapy is no different. But when you work with someone who knows what they're doing or follow a program that can lead you in the right way, you can easily become a safe and confident home ozone user, just like I have.
And why did you or why would someone consider learning this and becoming skilled at it? What's the motivation for it?
There are so many. Honestly, I would not feel anymore. So I started ozone therapy in 2018, but I would feel kind of like naked without ozone in my life now. And I can use it in so many different ways. Like last year, my husband got jock itch, and we used different ozone treatments to heal the jock itch. We got toenail fungus from living in mold for 2 years, and I quickly addressed the toenail fungus. Say if you get a headache, you can do ear and nasal insufflations. Say you are getting a cold or you feel sickness coming on. I know exactly what I need to do with ozone to infuse my body with oxygen and support my immune system. Ozone is an immune modulator. And there are just so many different ways that I can use it in every aspect of my life that now I've come to kind of rely on it. And it's such a beautiful treatment, and it can be used in so many different ways to heal.
Amazing. Like we alluded to earlier, we did a full episode on all of this. So if your interest is piqued by hearing this, make sure and check out that episode. Alix, as always, thank you.
Thank you, Josh.